Hey guys, it's VT Gamer Girl 11 back with another video. I went back to the doctor today and pretty much got bad news. I have to go back and have another surgery, paperwork on December the 12th to get it out. Pretty much they're going to take the plate out and the 6 screws that are on the plate on that side, and then possibly take the other 2 that are on the other side out, but those 2 are like really long, and they're afraid if they take those out that the head of it's going to break off and then it's going to be like stuck in there forever. So I might not get those 2 out because he said that those 2 didn't need to come out, they wouldn't cause any problems or anything. But my plate apparently has moved or shifted or twisted or something along the lines of the plate has moved. You know what I'm talking about. Sorry, I'm still in freak out mode because I just got back from the doctor's. And one of my screws that were backing out, he thinks the reason why it started backing out is because like the plate moved some. So they're just gonna go in. It hasn't really, that screw hasn't backed out any farther since like the last time they checked on it, and everything's stable and everything's healed 100%. But he told me that I probably should get it out because if I don't get it out, it's gonna cause me problems in the future. It just freaks me out because any type of surgery freaks me out. And I know this sounds really weird, but the thing that pisses me off about surgery the most is like the night before where you can't drink or eat or take medicine or anything. And then the next morning while you're waiting to have surgery, you still can't drink, eat, or do that. So all that freaks me out more than the surgery itself. I don't know why, it just does. But he also freaked me out because he said that the incisions that they make to get them out sometimes can be bigger than the incisions that they made to put them in, and that sometimes it could look more ugly, as his term. So I just have like bad images in my head now because I'm afraid they're gonna like like have to like cut a different angle to get it out right, and it's just freaking me out. And then he mentioned how there's a chance of refracture, and if that happens, then they'll have to put me in a splint, and it'll take about 3 or 4 weeks to heal, and I don't want to have to go through that again. I know I sound like a baby, but God, it's been since July, and it's now November, and the surgery's happening on December 12th, so I'm kind of tired of this, and I want it healed because I can't work right now because of it, and it's pissing me off because I need to work, I need to get money, and it's seriously, all I did was step off a step and twist my ankle, and it broke that badly. On the upside of getting them out is one, I can get all of them out if I want to, but even if I don't get the 2 out that's on the one side, at least the plate and six of them will be gone, so I'll only be left with 2. I'll have better mobility. I won't have to worry about it in the future. He said it would only take about a week to 2 weeks to heal after they take them out, mainly because of the pain level, from there being holes in your bone, and from the staples that they give you, your suture. But it's also freaking me out because my surgery is on the 12th. My first post-op is on the 20th, and I run out of insurance on the 31st. So I don't know how long it takes to get staples out, and quite honestly, I don't remember how long it took them out the first time I got them. But if they can't take them out before the 31st, I'm not going to have insurance anymore, and it's going to cost a fortune just to have them taken out. So I'm like extremely freaking out. I don't know what to do. I need to have the surgery. I don't know whether or not I can afford to have a surgery insurance wise. It's really not bothering me anymore. It's just kind of like making, I have like less mobility and like really stiff, and it's just that one screw really that's kind of bothering me, but not much. So it's like I was expecting to go in there and for them to tell me that it's, from where it backed out, it hasn't backed out any farther because that's what they told me last time, and that it should be fine. And a little bit of pain that you have or achiness or whatever should go away within a few months because you're still healing, you're still in physical therapy, everything will be good. That's not what I got. Instead, I got a little booklet with my new surgery and my new special instructions and my post-op, which is on the 20th at 10:15, and all those little things that they give you that, tells you what to bring with you, and what else is in here? I haven't even looked yet. They give you a patient procedure checklist, so when you get there, and all the same stuff basically I got the last time. How to take care of your surgical site, infections that might occur. It's another thing he said is there's a 1% chance of infection. Okay, I'm sorry, but I know it's really, really low, but any chance of infection at all freaks me the hell out because I don't want to lose my leg. I know I'm like overreacting. I'm sorry if I am, but it's like really creeping me out. Supposed to go on here, write down all your surgeries that you've had. But in case you're curious, I've had wisdom teeth, um, plus, okay, there's like 2 random ones that doesn't count my leg, and then, which counts the wisdom teeth, so those 2 random ones, and then I have 1, 2, 3, 4 with my leg. This will be the 5th one for my leg slash ankle. So, I gotta list all that on here, and same exact stuff. I don't understand why they can't just stick this in the computer so you don't have to go through it again. Oh, not to mention, when you go in there to have the surgery, after you've written all this stuff down, they ask you it again anyway. So what's the point? Like, they literally, you can tell them, I have the paper, all my stuff's on that, and they still ask you anyway. So seriously, what's the point? This is for all the medications you take, and the dosage, and the route that you take it, and how often. And yeah, that's it. So, not that you guys care what's in the folder, but I'm kind of on a venting spree because my thing is, if you're gonna put stuff in and you don't think accordingly, it's like, he said that he told me that I might have problems just because of where the plate was, where he put the plate at, just like the location in general, but I honestly don't remember him telling me that, and now it's just kind of freaking me out because it's gonna cost more money, it's another surgery, more money that I do not have, even though I need to get it done. So I'm really confused. I don't know whether or not to just call it off and live with it, or whether or not to have it. And it's just, yeah, leave your support below. I need it. Thank you guys for watching, and have a good day.